Hi there! For this presentation, I chose to look at the drug Abilify. It also is known by its generic name of aripiprazole. Abilify belongs to the therapeutic class of antipsychotic medications, and it belongs to the pharmacological class of quinolone derivatives. So antipsychotic medication, its main effect is going to change the actions of chemicals in the brain of the person who's taking it. So some indications for why one might be prescribed Abilify include treatment of schizophrenia in adults and adolescents aged 13 to 17, treatment of manic/mixed episodes associated with bipolar I disorder in adults and pediatric patients aged 10 to 17. It can be used as an add-on treatment to other antidepressants for adults who have major depressive disorder. It can be used to treat irritability associated with autistic disorder in pediatric patients aged 6 to 17. And then it also can be used as a treatment of Tourette's disorder in pediatric patients aged 6 to 18. Now, with most medications, there come contraindications when we should not be giving it. Some of those include we need to use caution in patients that are at risk for falls, because Abilify can increase their fall risk. We shouldn't be giving it to children who have depression. We also need to double check to see if the patient has a history of seizures or conditions that can lower the seizure threshold. And two of the big black box warnings associated with Abilify is patients should not be taking it with opioids unless that is the only form of treatment that they can take for pain management. And we also need to be extremely cautious with elderly patients that have dementia-related psychosis because taking Abilify does increase their risk of death. Some adverse effects that occur with Abilify include blurry vision, increased drooling, muscle stiffness, uncontrolled muscle movements, nausea, vomiting, constipation, headaches, dizziness or drowsiness, feeling tired, and also cold symptoms. Abilify does have a lot of interactions. Some of the more common ones that we see with other medications. We need to avoid alcohol since it can increase central nervous system effects. It should not be taken with grapefruit juice because that may increase drug levels. It should not be taken with opioids, as stated earlier, because that can cause slow or difficult breathing, sedation, and even death. We don't want to give Abilify with benzodiazepines. The result might be excessive sedation and orthostatic hypotension. We also don't want to give antihypertensives with Abilify because Abilify will enhance the antihypertensive effect, which is not good for the patient. So some of the things we need to take into consideration in our assessment is that the Abilify is not safe for elderly patients with dementia. It can cause fatal CVAs to occur. We need to monitor for hyperglycemia. We need to monitor for symptoms of metabolic syndrome such as weight gain, hypertension, and again, hyperglycemia. We need to monitor for new or increased compulsive or uncontrollable urges, monitor for infection, assess fall risks. Good rule of thumb is to treat with the smallest dose for the shortest amount of time, and to always give the prescription in a small quantity to reduce the risk of overdose. If a patient is getting Abilify in patch form, we need to change the patch weekly. And then also in children, if they receive Abilify, we need to monitor them because Abilify can increase the risk of suicidal thoughts and behavior. So when a patient is going to be taking this, we need to do some teaching. That includes observing for clinical worsening of suicide, cautioning the patient or caregiver to not mix with benzodiazepines, do not stop it abruptly, to use caution while operating or driving heavy equipment, to limit strenuous activity to avoid dehydration. Gradual improvement in symptoms isn't going to occur overnight. It'll occur in weeks. And also for females, they need to consult a provider first before breastfeeding. So I hope you learned a little bit about Abilify along with me.